to make sure you got this part. Okay, so frontal, parietal, and then temporal, like the temple, right here. Okay, now the open bullets underneath the given bone, that's a part of that bone. Part of that bone. All right, so what's next under temporal?
External auditory meatus.
Yeah, first thing, yes, the external auditory meatus. Outside hearing hole. External, outside, auditory or acoustic, hearing, sound, and foramen always means hole. If you can get a little information out of the word, if you can remember, like foramen means hole, that's going to help you find that particular structure. So that's right there. Of course, that's your ear hole. See, I got to do this.
And I'm zoomed in, so
I'm
zooming out.
Camera 2.
Post that on our e-learner.
Next.
try.
All right, styloid process. So underneath these pointy things, you remember the stylus, the thing that you use on the tablet or whatever? Pointy thing? That's what that is. Two pointy things.
What is the function of that?
Yeah, we don't need no functions.
Okay.
But
Yay.
it probably is a muscle attachment of some kind.
It's a pointy thing.
Zygomatic process or arch. So this is the zygomatic arch. It is the bone, it's not the zygomatic bone, it is a connector between the temporal bone and the zygomatic bone. Zygomatic arch.
So how would we write that?
Zygomatic arch.
Well, I mean, it already
Connects
says like-
ear to
That's what you'd say.
occipital.
It's
The
like
thing
a bridge.
that sticks out, it's the bridge. It sticks
Looks like a
out
cheek.
from the temporal, goes to the cheek. Be coming up towards your cheek. Mastoid. Mastoid process is this big bump underneath, big fat bump. You can feel that one behind your ear. Sometimes it gets a little sore because that's another muscle attachment. In fact, in muscles, we'll have to know the sternocleidomastoid, which is the only neck muscle I'm requiring you to know. Its name comes from the fact that it's attached to the sternum, the clavicle, cleido, and the mastoid process. So sometimes if you know a little bit about the name, you can figure it out.
So what, mastoiditis, what actually gets the inflammation?
Yeah, so the muscle and joint that, or the muscle connected to this location through the tendon probably causes some amount of inflammation. Mandibular fossa. So the temporal bone has, you can always tell in these plastic models because there's these little plastic inserts right there. The fossa is a pit or depression. So mandibular fossa is the pit or depression that creates the hinge point for your mandible. All right?
So the hinge of the jaw.
Hinge of the jaw, which you have to call the mandible. Now, this point on the mandible then is therefore the mandibular condyle. The mandibular condyle fits into the mandibular fossa. Yes, believe it.
Oh, I know, I've had surgery on both.
Okay.
of
Yes.
Yeah, so your TMJ,
Yes.
there's your TMJ problem right there.
Pubic hair.
those.
All right, occipital. Occipital's underneath. Back here and underneath. Anybody watch Bones or talk about how somebody gets murdered? They're like, oh yes, it was a 45-degree angle into the occipital lobe. They're talking about the brain matter behind this occipital bone. Two features on it. This big hole, foramen, what was that? Hole. Magnum, big. It's the
Wow,
big
these
hole.
are really
Yeah. That is where your spinal cord connects to the brain. That's the hole that would run the length towards the vertebral foramen and the vertebral bones. Now, just lateral to that big hole are these raised smooth areas. These are called the occipital condyles. Condyles. They articulate with the first cervical vertebral bone, which is going to be called the atlas. And that's in your list on the other side, but we'll do that later. All right, sphenoid. So, the sphenoid bone is a tough one to describe. I basically say it's behind behind the nose and between your eyes. Behind the nose, between your eyes. Now the parts I want you, or everybody wants you to know, I want you to know, are best viewed inside the cranial cavity. So, if you can see that outline, you might resemble a butterfly. Can you see that down and back up, this area right in there? That's the sphenoid from the superior aspect from the surface. This is
The
usually-
indentured part, like the part that's sunk in, or the part that's
the
sticking
yellow,
out?
see the yellow outline all the way around? The yellow outline.
I don't see yellow.
I don't see yellow nothing.
Oh, yeah.
Very faint brown.
Yeah, it's
I see it now. See the
Okay.
yellow?
So,
She's like, right.
Okay.
I know. I'm like trying to stick it inside the head.
alright, so this part up here, that's kind of more linear, this is called the lesser wing. And then the two more roundy areas right here, that's the greater wings. Greater wings, lesser wing. Now, in the middle, there's this very deep U-shaped depression where my finger is kind of stuck in. This is called the sella turcica. That literally means Turk's saddle, which apparently is a deep saddle. So I try to tell students, think about yourself sitting in the saddle, riding your butterfly. That's your sphenoid. All right, now, actually, that's real function there is to serve as a nice place to cradle the pituitary gland that hangs from your base of your brain. That's where that sits.
Do we need to know that?
No, just little stories to tell you to try to remember
Yeah,
some
I like the
things.
stories.
Okay, now this one right here, it's just a little nub that sticks out, almost looks like the head, if you will, of the butterfly. But that's a different bone. That's called the ethmoid bone. Now the ethmoid, of course, is kind of between the eyes and above, but we see it, and I show it to you and ask you to know it from this surface. Now there are two features for it. One is a prominence that kind of sticks out. It's just this little nub that sticks out. This is called the crista galli. This means rooster's comb, like the thing that sticks up off the top of the rooster's head. Now below that, typically you can see it best because students take the little pencil and pens and mark it up. So below that little prominence there in this area between my fingers is called the cribriform plate. Cribriform plate. Down there where the black spots are. Now, if this was a real skull made of bone, you'd see little holes, perforations in there. And this is where literally your smell nerves run up from your nose and through the skull and attach to your brain so you can smell stuff. That would be associated with the ethmoid. Sutures. Let's put this back on. So, skull bones are connected. You see these kind of woven areas here. Used to be soft tissue, but once we got out of mom's womb and through the birth canal, over development, we ossify and these become more permanent. But they have names. Most of them are based on the names from the planes that we probably learned from chapter 1. This one right here, it's called the coronal suture, or you can also call it the frontal suture, because it's right behind the frontal bone. That's easier to remember. But the coronal suture, or coronal plane, cuts you into front and back. So that's why that runs that way. This one between the parietal bones, this is known as the sagittal suture, because we know sagittal would cut you typically into left and right. This major one between the parietal and occipital here,
One looks like a moon, like crescent moon shape.
this is going to be called the lambdoid or lambdoidal, I don't care which one you say, suture. Lambdoid or lambdoidal. And then along the side here, between the temporal and occipital, much fainter. Notice it's not as squiggly. It's a little flatter. I mean, it does have its curves, but it's flatter line. Squamous means flat, right? Squamous or squamosal suture. Okay, rest of the skull we refer to the mandible, the flat lateral areas here, both sides, ramus. Refer to mandibular condyle. That's, again, where we articulate and hinge with the mandibular fossa in the temporal bone. And then notice that big pointy prominence just anterior to or forward of the mandibular condyle, those 2 points. Coronoid processes.
Looks like sharp teeth.
There you go. Now, it turns out that this is a major connection point for some of the muscles that pull your jaw up and shut your mouth.
Very important.
Right.
Seriously.
All right, rest of the skull. So the bone that holds your upper teeth in, all this here and underneath, maxilla, however you want to say it. Now, I tell students this, I don't know if it matters to you, but if you drag your tongue across the roof of your mouth, and while it's still kind of hard and solid up there, that's still maxilla. But you ever notice it, you keep pulling it back and it'll drop down and hit a soft spot? That's over a different bone, which is called the palatine bone.
Oh, that's awesome.
So this is the palatine bone, this strip right here. And that's where you feel that division when you drag your tongue.
So the maxilla is like the bumpy part of the top?
Yeah, and then it drops up, I guess.
Like the end of it.
Back,
Yeah.
and then it gets like the smooth part?
Yep.
Okay.
Yep.
Where your mucus drops down your throat.
All right,
Right
next.
here.
Zygomatic, this was the cheekbone proper. Again,
I forgot she's recording.
that connects through the zygomatic arch towards the temporal bone. So these are the zygomatic bones, zygomatic arch, temporal bone. Lacrimal. So the best way would be to remember that you got basically 2 holes in a couple bones right here. This is where your tears drain to, through the lacrimal duct. So the bone that has the hole in it, you see that little hole? That's going to be the lacrimal bone. Nasal bones, the actual bone will be the upper part of your nose, 2 bones there. Remember the rest, the soft part is hyaline cartilage. Vomer, basically the bone that divides your left and right nasal cavities, so this down right through here.
Is that what the doctor calls your septum or whatever?
Yeah,
Deviated septum?
it potentially could be, right. And then these little nubs that are sticking into the nasal cavity on both sides, you see there are a couple up here and a couple down here. See those little nubby things? All right, so
Oh.
the lower ones, I just arbitrarily picked one, these are called inferior nasal conchae. These are your scrolling nose bones. And you'll learn in AMP2 through the nasal passageway, this increases surface area to help warm your air as it moves through, et cetera, but you just need to know the structure at this point. The lower one's the inferior. All right, then there are 2 paranasal sinuses I'd like you to know. There are hollow air-filled pockets or cavities in your skull, and 2 are located here above your eyes in the frontal bone, so they're called frontal sinuses. And then down here in the maxilla above your teeth, there are some air-filled spaces. This would be the maxillary sinus. Lightens up your skull, but it also helps to warm the air as it passes through the skull on its way through the nose and down the air passageways towards the respiratory system.
It's also where you get sinus infection.
Absolutely. So they get inflamed.
When your doctor does this.
Yep.
Yeah.
Yeah, they
And why your teeth hurt when you have a sinus infection.
exactly.
Interesting.
A lot of nerves running through there, and that's why it can get painful if there's inflammation or any sinus pressure buildup. The last bone really is not part of the skull per se, but it hangs below the mandible, and that is the
I got you on that one.
hyoid bone right here. All right, so that's its own bone. We just associate it with the skull.
Where do you feel it?
It'll be a little higher. It's it's kind of buried
Smile
down
again.
in there.